Afterwards, we will send out a feedback form, and we'd be really grateful if you could fill that out for us. This is the first webinar that we as young leaders have run in Scotland, and it would be great to hear what you liked about it and what you think could be improved. And as I said, the recording will be sent out afterwards, so you can have a look at that if you miss anything this evening. In terms of the question and answer at the end, if throughout the webinar you have any questions, can you use the question and answer feature at the top, or is that's just disappeared from me? Can anyone else see that?
It's all right for me, I think. You're all good.
Okay, it should be at the top on your top bar, just beside the chat button. And we will try and get through as many of those questions as we can at the end. If there's any that we don't answer or that we need more time to think about before answering, we'll send out a wee document with all the questions and answers afterwards, along with the recording. So we're just going to all introduce ourselves before we properly get started. So as I said, I'm Ailey, I'm 22. I'm currently in my final year of uni, and I've had type 1 for 18 years.
Hi everyone, I'm Vidika. I'm 18. I've been diabetic for 2 years and I'm just away to go into my first year of uni.
Hello, I am Valentina. I am 24 years old and I'm currently pursuing a PhD, and I've had diabetes since I was 5 years old, so for 18 years.
Hi everyone, I'm Alex. I am 19. I've had diabetes for around 8 years and I'm about to go into my second year at uni. So I'm just going to quickly run through what we're going to talk about today. So we're going to start looking at the transition from peds to adult clinic, what we liked about it and what we thought maybe could have gone better. We'll look at having a diagnosis during this transitionary period of life. We'll look at disability services and higher education. We've had a real mix of experiences between us. I'll talk about exam adjustments, about moving base, whether this is moving flat, moving city, or even moving country. We'll talk about social life and navigating a new social situation with type 1. Technology, between us we're on a mix of tech and have probably experienced most of what you see day to day. We'll then come to a conclusion and finish with our Q&A.
So first, we're going to be talking about our experiences of moving from paediatric diabetes services up to adult ones. And when we had our first meeting talking about what we wanted to include in this webinar, a big thing that came up was what age was best to transition at. We're aware that this transition age seems to be getting younger and younger all over Scotland, and we found that even between the four of us, we had quite different views on it. One of the positives that came up for moving at the younger age of 16 was that you're treated more like an adult at that pivotal point in life when you've got big exams happening and when you're moving on to work or further education. And at that point, you don't really want to feel like you're being treated as a younger kid. And then the negative of that moving at 16 is that you are still very, very young, and you're moving into a service that is ultimately built for adults. I'm not sure how many 16-year-olds are fully matured at that point, but from my experience of PEDS services, they seem to be experts in transitioning in general. So they do nursery to primary transitions and primary to secondary school. And as a team, they might be better equipped to help with that tricky transition of leaving high school and moving on to work or higher education. A positive of moving at age 18 is that you get that continuity throughout high school. When it feels like everything else is changing around you, at least your diabetes team would be a constant in that. And then, kind of mentioned before, a negative of moving at 18 is that you can feel like you're in a service that is built for kids, because it kind of is. And this is particularly felt when people are inpatients or at face-to-face outpatient clinics. We understand that a lot of the time you guys as healthcare professionals don't have much control over this and that it's completely out of your hands. But we thought it'd be interesting to hear some of our insights on it. The next thing we talked about was what kind of preparation we had for moving up into adult care. We all had very different experiences of this, and something that I found striking on the lead up to transition was the negative assumptions that people like in the public had about adult diabetes care at the time, and whether that was their personal experience or something they'd heard from someone else. My family had heard stories of people only having contact with their GPs and struggling to get tech funded within the adult services. Whilst this is definitely not the case for all and not what any of us have experienced, it's maybe a preconception to be aware of, because I certainly would have felt a lot more confident going into adult services knowing that these facts weren't necessarily true. In terms of the actual preparation for transition, Alex shared with us some really great experiences that she'd had, as well as having a group clinic day that was about more teenagey stuff, and how diabetes impacts that. She also had clinics both with her new adult team and her old peds team. And having this phase transition really built up her confidence with the new team over time and helped with that move. I had quite a different experience of transitioning up, where my last peds clinic was just before COVID hit, and then my first adult one was quite a wee while later and was a phone call. I then moved my team to where I study, so that was another big transition at that point. I'm well aware that COVID had a massive part to play in the lack of any transition that I had, but it definitely made me feel a bit like a fish out of water, and that I never quite knew what to expect from healthcare for those couple of years.
So then we went on to look at this transition into adulthood and adult services, which also comes with a newfound sense of both responsibility and freedom. At this age, you start to become more responsible for the outcomes of your own health, which can be quite scary. And alongside that goes the topic of the involvement of parents. So we felt that as the healthcare professional, you have the ability to guide the format of these appointments. And at this time in life, we think it's valuable to start trying to encourage young people to spend at least part of their appointment one-to-one, maybe bringing them straight into the appointment and then having their parents join afterwards, so that it feels less like the parents are being kicked out of the appointment to them. This then allows the young person time to voice things that they might not want to with their parents present, and it also just weans them into the independence that comes with adulthood. But this should absolutely be presented as an option. Some people might not feel ready for this, and it's a very daunting experience if you have it forced upon you. Another excellent opportunity which I was given was being provided the option to bring along somebody else to the appointment, so maybe a friend or a partner instead of your parents. This creates a really comfortable and open environment, and it's really valuable at this age because realistically, these people are our support systems in the real world. And so having that insight could be really valuable for everyone involved. With this extra bit of freedom, we know there can be a bit of a tendency to rebel as well. But the only advice we can really give to that is discussing things as openly and honestly as you can from early on. Even if the young person isn't really engaging with the topics that you're covering, it means that they know you'll be there to listen about anything. The move to adult care also introduces a decrease in the frequency of appointments, which is completely expected and by no means a complaint from us. You're busy and so are we. But between us, we have found that the consistency of these appointments isn't so great, and there's a bit of an expectation placed on the young people that they need to reach out if they want to talk rather than having regular appointments. Realistically, we don't think a lot of the people who will need the most help are going to take the initiative to reach out and create this appointment. So a resolution we've come up with, which we feel is reasonable, is to have a direct communication line with clinic through a messaging system, which is definitely a way to bridge this jump from, in some cases, 3 monthly to yearly appointments. And we feel that having the option of this informal communication link makes it feel a lot more accessible and low stakes. Finally, we appreciate that it can be tricky reaching teenagers at this time in their lives. We understand it can be hard to find a way to reach and engage with teenagers, especially when they gain this freedom to attend appointments alone or maybe not come at all. Our best advice for this is to create a comfortable and friendly environment. It'll help ease pre-appointment nerves, which we've all experienced, and we all know the feeling of thinking you'll be in trouble for poor results, even though this has never been the case, or having forgotten to upload data before your appointment, even though we know most of the time this isn't as big a deal as we make it out to be. Really, we think that although graphs and data are really valuable, sometimes we don't even fully understand them. And so one of the things that makes me personally feel most at ease going into an appointment is when my doctor asks what I'm up to in life and we link diabetes into the conversation. It just makes me feel like I'm a person over a patient, and our day-to-day life can totally explain a lot of our results as well.
Is there a noise, I think, coming from someone's? If you could just mute your mic. Sorry, thanks. Vidika, is your slide, I think?
It's not showing up on my screen, actually. It was just a way to say.
Oh, isn't it? Can other
No.
people see it? Yeah.
I think I can move some of them myself, so I'll try that. Okay. So I'm going to be talking a bit about diagnosis at a transition period because I was diagnosed at 16. So I already had a pre-existing history with PEDS, so I had a bit of knowledge in a hospital setting. For me, it was quite hard to get diagnosed because it took almost 6 months. I had GP appointments in and out at that time and did lots of blood tests, couldn't really figure out what was going on. So I ended up getting referred to my PEDS team and they did further bloods and I was found diabetic. At that point, I was already 16, so I was immediately kind of sent off to the adults, young persons clinic sort of thing. And it worked really well for me. So I wouldn't really particularly say I had a transition because I was one day in peds and then the next in young persons and adults. But for me, I think that worked really well because I completed the step guide with them and have my regular appointments with them. I honestly loved the young persons clinic because it felt like an open communication. As what Alex was saying before, it was very honest. It felt like there was no judgment and it felt very directed at my stage of life as a teen. And it made appointments a bit more trustworthy. I had more regular appointments, I would say, going into young persons, which is a bit more different to the rest of the young leaders. But I think that worked really well because I had a constant two-way communication with young persons. It wasn't just me reaching out, like Alex has mentioned previously, which is really amazing because it's helped me a lot. And I love that the fact that the young persons always spoke to me. It was my sense of owning up to, like, I have diabetes, it's my thing, not really my parents, which was really nice to see. So yeah, I would say if those are some things to take away, is the newfound sense of responsibility is really appreciative, and not everyone will appreciate it, but it's nice when you have the option to have that at you. And a two-way communication, I would say, is a big takeaway.
So type 1 diabetes is considered to be a disability according to the Scotland Equality Act of 2010. And as such, patients with type 1 diabetes are eligible to receive a lot of the adjustments that other disabled people are also entitled to. However, a lot of people might not want to take those adjustments. But regardless of the situation, I think it is important to be aware of what services are available to someone with type 1 diabetes, because they might make their life a little bit easier, especially when they're transitioning to university in a new environment. So to make the adjustment a little bit easier, I think it's worth to be aware of what is available. I am aware that in the UK, when you apply to university, you can flag up on UCAS whether you have a disability, and this would make adjustments further down the line a little bit smoother and easier. For instance, they might already put you into contact with the disability service at the relevant college or university, and also they might have more specific adjustments, for instance having a mini fridge in your room for your insulin. However, for instance, I was not aware that in the UK for my diabetes was considered to be a disability, and therefore I went all throughout university and my master's without making any adjustment, just simply because I did not know what I could apply to. However, after doing my own research, I discovered that the Student Agency Award Scotland, SAAS, they provide additional funding for people affected with disabilities, including type 1 diabetes, and this might open up a lot of opportunities that we would not otherwise be not eligible for, but they make things easier, and we can have extra funding for studies, internships, for traveling because of our studies. So I think it's something that's very important to be aware of. And I think that as healthcare professional, you have a very important role in also informing the patients of what local services and services within the area are available, because the patient may not always be informed themselves. And it's also important to note that in addition to all of these institutional services, there's also more local support groups and support teams that may be beneficial. And one of such groups is Together Type 1. Yeah.
So I'm just going to talk a little bit about my experience of exams. So for my first 3 years of doing exams, which were my Nat 5s and higher, I didn't have any assessment arrangements at all. So I went and sat in the big hall with everybody else, which added a lot of extra pressure and worry. It led to me turning off alarms and running a bit high out of fear, which probably didn't help my overall performance. And despite having approached countless teachers and invigilators over these years to inform them of my diabetes and to let them know that I would have a device on my desk and things like that, I was still never told by anyone that I was entitled to having exam arrangements. Eventually, I did end up getting exam arrangements for my last year. And with this, I had a private room with a personal invigilator, which relieved a lot of pressure knowing that I could take the time I needed to get myself sorted. I was able to have any devices I needed, not worry about alarms going off. I could have food and drink by my side. And although I didn't need my phone, I was also given that option. I could stop the clock and resume it when I was ready, which was particularly good for my advanced higher exam, which lasted 3 hours. And I was also given the option to have a planned break if I wanted to. This was all a really amazing experience and absolutely revolutionary in my exam career. Ailey had the experience of being put in the quiet room with other assessment arrangement pupils. The only issue that comes with this is it maintains that anxiety around disturbing other people's exam with alarms and constantly turning them off out of fear, which risks missing a low when it has a big impact. So this isn't the most ideal option, although it's still better than nothing, and it could potentially depend on the capacity of the school. There are a lot of nerves that come with exams, and it's one of the most important factors. You could go high, you could go low. It's really hard to predict. And the nerves of the exams themselves are not worrying about diabetes is an added load, and it can feel a bit like an endless cycle. Really, what we can ask of you as healthcare professionals is to be a voice of reason for the schools or the unis on behalf of the young people. Unfortunately, sometimes in school situations, teachers or school contacts are unwilling to take the student's word. So you being able to provide something like an email or a letter or start a conversation with whoever organises these exam adjustments for that patient is incredibly valuable. Once leaving high school and moving into higher education, I think the key is to keep exam conditions as consistent as possible. This consistency can be really comforting in a highly exam-inducing scenario. Really, ideally, what you can do is have a written record of the adjustments that the young person has received. Maybe you have a copy and they have a copy. That way it can be backed by you if the higher education has any concerns or questions. The difference between high school and uni exams varies for most people because at uni it can be so different depending on your subject. The disability service are there to support at uni, but they're a very busy team of people, so they require early contact, which is something you could encourage young people to do. In general, there's a lot more independence required at uni, so it's important to know that the young people need to be prepared. My personal experience at uni so far has been a far more flexible exam situation. So mine were all online and they lasted 24 hours. So I could eat, I could treat my blood sugars, etc. as I pleased, but this does vary vastly depending on the course. It's also really good to make sure young people know about good cause claims, or some unis call them mitigating circumstances. So if their blood sugars were bad for a period of time, like during an exam or over a period where they were doing an assignment, they can submit a claim to make the uni aware, and they will take it into account. This could either be adjusting the grade or allowing a reset or extension. Really, the key takeaway about exams is that you as a healthcare professional need to help make sure young people know that they're entitled to these. From there, they might take it into their own hands, but they need to know about the opportunity first. And this is particularly important for those that are considered well managed by the school. Maybe they aren't aware of the pressing issue that their diabetes might cause in an exam.
Another big change that can happen around this time is moving out. Valentina and I are going to talk about this because I've moved city for uni and she's moved country. So leaving behind your support system can be quite a big part of this. For many of us, particularly diagnosed as younger kids, we've become so used to everyone knowing about type 1 and not having to explain things. This makes it a bit more daunting moving to a new place where genuinely no one knows you. Practically speaking, leaving behind carers, parents, grandparents can all be quite a big deal because they've been pretty involved in day-to-day care. For example, a big jump up for me was pump site changes. Whilst I could do them myself and had done many times before, it was that last step of firing the cannula in that got me, and if a parent was about, I would definitely take advantage of that. I was lucky that this was the only thing they physically did for me, but many people still rely on parents or carers to make adjustments to things like basals and ratios, and this might be a bit trickier to adjust to. These are all things that are very different for each person, and the thing that's going to worry them most will be different too. So setting some time aside to explore this in appointments could be helpful. And then after choosing to study at a uni in a brand new city, the next step was deciding whether to move my diabetes care with me or keep it at home. This was a big decision. Lots of questions were raised. What was going to be easiest? What was going to be closer? Which team was better? And would there be any funding differences for tech in different health boards? It was clear that there was no right or wrong answer, and I decided to move my care up to the city that I study in. For me, it was quite an easy decision. I hadn't properly met the adult team in my home city, so I didn't have much to compare it to, and I wasn't leaving much behind as I'd already said my byes to the PEDS team. I don't regret this decision, as being in the same city as my diabetes team has definitely been easier logistically. But then there is moving primary care too, and that was a struggle. So hurdles like finding a GP who was currently accepting patients, not knowing how to get prescriptions moved over, and things like that. I spent a lot of time on the phone in appointments, wasting far too much GP time trying to get each prescription moved over correctly. From the right ketone strips to backup insulin pen fills, it was an organisational challenge to say the least. And then there was the consideration of spending time in two different bases throughout the year. So one of them being at home with family and one of them being at uni. And these were just the little things that I hadn't anticipated at the time. The first thing is I'm not a very forgetful person, usually quite on it, but the number of times I've forgotten insulin moving back and forth from home to uni is a bit ridiculous. Home wasn't usually a place that I had to consider bringing supplies back to. They were always just kind of there growing up. So it was quite an adjustment to remember everything. And then not being able to get a pharmacy to give me things like sharp spins back at home after leaving primary care there. And I still haven't figured this one out. There's a very large bag of sharps back at home waiting to be disposed of. But I think as you go along, you learn different tips and tricks. Things like keeping a bag of pump supplies back home so that I don't need to bring them back and forth every time. And I guess it's a bit like practicing packing for diabetes on holiday every month or so, which can never be a bad thing. And then the next adjustment was adjusting to the new healthcare system. So it was things like navigating differences in how clinics are, or how you're invited to clinic, how you make appointments, when you get your bloods done, getting access to sharp spins, and many more little things. It felt like I was doing it all by myself at the time, and it was all very confusing. I hadn't had contact with secondary care at this point, and an earlier meet up with them would have eased this transitional period and kind of guided me through it.
With type 1 diabetes, having a good endocrinology team is absolutely essential. And in fact, it was one of the main things I was sorting out when I moved from Italy to Scotland. Especially when moving to a different clinic, I think that having a sort of continuity of care is absolutely essential. And making a transition to different doctors can be daunting in itself, because I was in a pediatric clinic in Italy, and so I was used to the same doctors for over 10 years. And then I moved to Scotland, where I didn't know anyone. And also it was the first time where I had to take care of my condition in a language that was not my own. And on top of that, in the EU, we use also different units of measurements for the blood glucose and for the HbA1c. And therefore, there was a lot of adjustments when I went to the first clinic in Scotland. And as Ailey mentioned, different doctors operate differently. So there's inherently some change that's supposed to happen. So I think the main takeaway point is that when there's an appointment with someone new, to make sure that you take the extra time to let them explain how they were treated in the previous clinic. And so, if possible, to make some of the adjustments to make this transition as easy and as smooth as it could possibly be. And also being patient with what the patient is asking you. So for instance, an example is I had no idea how the millimolar 2-liter glucose, like what was about. I didn't know how to work the numbers out. And for the first few clinics, and sometimes even to this day, I get confused because whenever I do my blood tests in Italy, then of course it's in the units I'm used to. And then when I'm here, I use a completely different number. And therefore, I think it would be useful if you're having a patient that's not from the UK to at least have the table of conversion so that you both know what you're talking about. Because I think the first appointment that I had was just completely useless because no one knew what numbers I was talking about, which is fine. Then I learned from my mistakes. And also, I think that you should take the extra time to explain how to order supplies, whether you have to contact the GP or the insulin provider directly. I think that's something important to do. And maybe also having more appointments that are closer in time rather than having them once a year. Because I think that was quite difficult to just have one appointment a year when you're used to having appointments more periodically. But baseline is understanding that it takes time to adjust to something different. Yeah.
So me and Valentina are going to discuss a bit about the social aspect, looking closely at alcohol and friendships. So between all of us, we've all discussed that having friends that understand diabetes or are willing to learn about diabetes is really, really important, especially when you're at that transition age, when everything's kind of new and your friends don't really know about it, can make things a lot harder if you don't have that support system around you. So I would say that HCPs should try and encourage as much as they can for young people to actively tell their friends, or even direct them towards resources and links on how to tell people, because I know a lot of people struggle to tell people that they have diabetes because they don't know what to say, how to word it, or things like that. And there's lots of resources online that help with that. So it'd be nice if HCPs could direct people to those, because they're really helpful, because I've been having a look at them myself around this time. So yeah. Another big part of socializing as you get older is alcohol. I personally have always had alcohol chats with my HCPs, constantly talking about what it can do, how it affects you. If I want to try things out, I shouldn't feel pressured to try things out. I shouldn't feel that I can't have anything. And it's always been a constant open conversation where I didn't feel any judgment. I didn't even have to bring it up myself. It would just be discussed with me, which I found was really helpful, especially like as young people shy away if they're in appointments with their parents, they don't really want to talk about it. So it's nice to have it brought up without asking yourself. But yeah, we discussed this idea of possibly even bringing friends to appointments so they can know what to do on like a night out if something goes terribly wrong. Hopefully it shouldn't, but they're there as a backup, and it can help make the appointment a bit more casual in a sense.
Yeah, I think that creating a non-judgmental space is very important in this situation because, as Vidika mentioned, there's always the stigma around consuming alcohol, especially maybe if you come from a more conservative family and that you shy away from drinking alcohol. But I think it's important to at least talk about it so that then when alcohol is consumed, it happens in a safer way. I think being aware of the effect alcohol has on blood glucose is essential, and before you start drinking, and also talking about how to adjust your insulin rates and what to eat to avoid too many fluctuations is important. And also, yeah, I think providing more practical and personalized guidance depending on the case as well. But as Vedika mentioned, I don't think it should be just a one-off conversation. It should just be talked about every so often, just to avoid the stigma and to keep the patient as safe as possible.
So I'm going to talk a bit about technology with diabetes. So obviously when we're first diagnosed, we're given little meters, and then we're moved on to CGMs. And I think personally for me, this was one of the best technology changes that could have happened. It just made things so much easier, and it made me feel better knowing I have like this constant thing that lets me know if I'm going up or down, other than me having to constantly check. So if it's one thing I would definitely say is HCP should definitely encourage CGMs, because I know a lot of people around this age are a bit shy about getting questions about it, wondering if it'll look weird or things like that. But I think it's definitely something that has helped with my management of diabetes the most. And then going on from that was insulin pumps. So I know there's a few ways to get onto the pump, which is through your local team or through the National Onboarding Service. So I had mine through the National Onboarding Service, which was an online appointment, and it was once a week for 7 weeks, roughly for an hour, apart from the actual pump onboarding, which was roughly 3 hours. And this was a really unique experience, I would say, because it's very comforting to have such a big change at home in the comforts of like your own space with the safety net of your family. But it's also a bit confusing because if you're not sure if you're doing things right, you don't really have someone right there next to you to check. But overall, it was a pretty good experience. It takes a while to get on, but once the process has started, it's really fast. What I found going onto the pump was that I had a lot more freedom to do things. I just had the ability to do things whenever I wanted. Not that insulin pens were restricting me before, but there was almost a change in my mindset now, which I found really good, especially during school, because it stopped a lot of questions a lot of the time and made things a lot smoother and a lot faster instead of me having to stop, take injections. I will say though that going on to a pump, there was a lot of learning curves and a lot of confusion at the start. It was kind of difficult going from injections to pumps, and I think while HCPs do highlight it, I think it should be emphasized a bit more that it is a big change. And I think the wording around pump should change a little bit, because when I went onto it, I almost had this expectation of I'm going to be magically cured. And it's definitely not what it was. But I think the wording around it should change a little more to be a bit more realistic. So the biggest takeaway I would say is that pumps and CGMs are really, really handy when it comes to diabetes and can make things so much easier and can even make things better in a social setting. But that's only if we're given the right support for it and the right knowledge. Because when you're at this age and you're starting things like exams, meeting new people, starting work, and you're dealing with technology you don't really understand or use effectively, is really frustrating and can make management a lot harder.
So myself and Caitlin are going to chat a little bit about the Together Type 1 community, and we'll give our young leaders a bit of a break for a few minutes because they've been doing a really good job at sharing their experience and everything. So, and yeah, just to say, because I don't know if we'll get a chance to say this before the end, but just the young leaders, they've worked really hard putting this webinar together, and yeah, just really appreciate everyone coming on, and I think it's very brave of them to come on and kind of share their personal experiences of having type 1. So I just want to say we're very proud of them, and yeah, hope to do more of these webinars in the future. So yeah, just want to say big well done to the young leaders. So yeah, I'll introduce myself. So I'm Roisin O'Donovan, and I'm the youth coordinator for Together Type 1.
Yeah, pardon me, guys, sorry. I'm Caitlin Beaton, and I'm the youth worker at Diabetes Scotland, and I work alongside Roisin on the Together Type 1 programme.
And so Caitlin's going to say a little bit about what Together Type 1 community is and what we offer, and then I'll talk a little bit about how you guys as healthcare professionals get involved. So yeah, take away, Caitlin.
Yeah, so we offer different things such as local group meetups, buddying, wellbeing sessions, talks, and attending conferences, and there's much more in between that, but that was just the bulk of it. So group meetups is an opportunity to connect with other participants in their areas. We do different activities which range from like informal meetups to meals to physical activity and team building challenges. There's essentially something for everyone, and we try our best to keep a wee mix of what we've been up to across Scotland. Also, these are expense-free meetups and will be fully facilitated by the Together Type 1 staff team and young leaders. So that's something that a lot of people don't know about Together Type 1. It is totally expense-free, so it's another incentive for young people to get involved. As well as that, we have the buddying programme, so that's an opportunity for young people to speak to somebody else, either one-to-one or in a small group environment, just chatting to someone who has type 1 in a safe space where they can share experiences and issues. Each participant would be allocated a young leader, and the young leader would be fully trained, and like all young leaders, they'd hold a full PVG as well. As well as that, we have some wellbeing sessions, which are called Sessions for Success. These are 6 sessions created by the youth team and a health psychologist called Courtney to combat low well-being and poor diabetes self-management. The sessions can be carried out fully online or in person, and again, it's facilitated by the youth team and sometimes a young leader if they're available. The topics for each session range from well-being to stress, self-management, positive relationships, managing clinic appointments, and positive self-talk and self-esteem. Something about these sessions is they don't need to be done consecutively. They can be done in bits and bobs. The sessions range from like 30 minutes to an hour, depending on the group size, the needs of the groups, conversations, and whatever activities we might choose to do on the day. But the sessions are typically done alongside a fun activity such as like rock climbing or painting or just a meal perhaps. Just to kind of keep the incentive there for people to attend. Again, these would be fully expense free. And then in terms for talks and conferences, previously carried out different talks in schools. Alex actually was one of the young leaders to first do that, and colleges, universities, and even clinics to spread words about the experiences of people living with type 1 and the Together Type 1 programme as a whole. These talks and stuff can be facilitated by staff members, but also the young leaders team as well. Some of our young leaders have recently attended different healthcare conferences. You might have seen our young leader Lucy recently at the UKPC. So the young leaders are always keen to share their experiences, share their thoughts and opinions, and just act as ambassadors for people living with type 1. We're keen to get more involved in stuff like this in the future as well. So if there's anything that's coming up that you think would be ideal for, even just giving myself or Roisin a wee email, that would be ideal. So that's just some of the offers that we have Together Type 1 right now. And I'm going to hand you back over to Roisin now, so she's going to talk about what HCPs can get involved in and stuff.
Thanks, Caitlin. Cheers. Yeah, and I'm cautious. It's lots of information there to take in. So yeah, we do have healthcare professional packs that we can send out. So in the feedback form that you'll get after the webinar, and there's a question at the end saying if you'd like a pack, and if you do, you can post it out to you, and that will have all information about TT1. So if you don't remember everything we're saying, that's absolutely okay. So yeah, just drop us an email or just fill in the form. And just to say as well, we're already aware there's loads of healthcare professionals that have already been engaging with us loads, inviting us to clinics, to conferences, coming to meetups, spreading the word about meetups. I recognise actually loads of the names on the call, so to say hello to everyone that we've met before, and to thank those that thanks to everyone that's been engaging so far. And really the main ask we ask from healthcare professionals just to get the word about Together Type 1 to every young person. Yeah, just shout about it as much as you can, because it's all just about getting the word out and making sure young people are aware of it. And it's a program for young people from 11 to 25, just to kind of keep that in mind. And yeah, just to kind of talk a little bit the young leader role as well. If you work with some young people that are from the ages of 16 to 25, and they become one of our fabulous young leaders that we have on the call this evening, and get involved in those different things. So we're always looking for more young people between those ages to get more involved. It can be quite a hard age range to target, or young people, because I know a lot of young people are busy with studies and work and everything, but yeah, it's a great volunteer role, and we just really appreciate it if you kind of keep those young people in mind that you're seeing. If you think they would enjoy the volunteer role, and please get in touch. We can also connect them with one of the young leaders as well to chat a little more about it too. So I'm going to stop talking now, and we're going to hand it back over to the young leaders if you guys are ready. So I'll put on the last few slides I think Ailey is going to do, and then we'll do the Q&A and everything. So thanks for listening to myself and Caitlin.
So I'm actually just going to jump in really quickly before Ailey brings us to a close, because I'd like to say a quick word about how grateful the four of us all are for all the support and amazing opportunities that we've had as Together Type 1 Young Leader volunteers. This community has helped us grow, learn and achieve our goals while feeling like we are making a real impact in our world. So we would like to say a huge thank you to Roisin and Caitlin, who are always there to support us and help us with our never-ending list of ideas and projects. None of what we've achieved would have happened without their guidance. So thank you from us and all the other Scottish Together Type 1 young leaders.
Okay, so I'm just gonna bring together some of the main themes of today before we get on to some of the questions, and what we think you guys as healthcare professionals could do or continue to do to make these big transitions a little bit easier. So we thought one of the big themes of this talk today was the inconsistencies of transition care across Scotland. And maybe this is a positive, because you as healthcare professionals are able to learn from each other, watch who's doing it well, and then adopt those new practices. But for some of us, it's felt like we never quite knew what we were expecting when moving teams. This can be particularly hard when there's so many extra things to think about with Type 1. Having a clear pathway of how this transition will look and exposing us to these ideas early would be super helpful. Medica demonstrated the importance of talking to us directly and showing that you're listening to us as a young person primarily, and not a diagnosis who will soon move off into adult services. Valentina discussed the importance of knowing what services exist to support us and how to access them. Whether we want to engage with them is another thing, but we should all know that they're there if needed. This follows on to Alex sharing her experience with exam adjustments and how much of an impact having a backup plan in exams can have. The most important takeaway is to make sure that young people know about assessment arrangements and that you're there to support them obtaining them. This is especially important to patients who are potentially classed as well managed, as the schools may not realise how much of an impact these adjustments would have. Valentina and I then talked about moving base and how this is such a massive change, whether that be moving from a family home into halls in the same city or a whole new country. There's so much to think about and so many mistakes to be made. I've learned that my love of organising is priceless in these situations and that no one can warn you about every potential mistake that you're about to make. Having a healthcare team by your side whilst navigating this for the first time would be invaluable. Vedika and Valentina then talked about diabetes in social settings and how this changes throughout teenage years. They also touched on positive ways to have discussions around alcohol in clinic. Vedika then finishes off talking about our experiences of tech and how the benefits of these can be portrayed realistically by healthcare professionals. We also all thought that having the knowledge that specific support groups for people our age exist would be amazing. So pointing young people to these kinds of things would be super helpful. If anyone wants any TT1 resources, I think Roisin's already kind of said how you can get your hands on them, but yeah, they're there to help you guys spread the word about TT1. Something else that we discussed was how lucky the four of us have been with the support around us throughout our lives. We've had sisters advocating for us at appointments, parents helping with supply orders, friends eager to learn about type 1, and much more. We recognise that not everyone has those people in their lives, particularly when it comes to diabetes, and that's where we think a clear, structured, supportive, patient-led transition would have the biggest benefit. We recognise that we definitely don't represent the majority of teens and young adults that you guys see, but we hope that the experiences we've had, positive and negative, can have a helpful impact on future practice. So thanks so much for coming along. We're just going to move on to a couple of questions that you guys have popped in the chat, and if you have any more that you think of, then send them our way.
Okay, so I'm going to start us off with our first question, and it is, what's one thing an HCP has done that has been helpful in self-management or general living with TT1? So for me personally, as I think Alex mentioned at the start, having a direct text line with your diabetes care team, for me has been incredibly valuable. It's given me that safety net that even if I don't have an appointment, I still have someone there just in case if things go wrong. And it's been really helpful because it's also made communication a lot more casual and open because of the form of communication it is. So it's definitely helped with my management. If I start to see my blood glucose dipping up or down regularly, I can just ask them about it straight away. So it's been really helpful.
Okay, I'll go next. So we've had one about what ideas we have for engaging with young people for their appointments. So I think a big thing is about offering flexibility, which I know most of you do. So we've obviously mentioned that thing about coming with a pal or coming with someone that's not necessarily a parent. And then obviously having the choice of whether you do it online or face-to-face or a phone call. I think making sure that young people never feel judged for their diabetes control and that they always feel like your team is a safe place to approach if they wanted to reach out. And I think this isn't just something that kicks in when we're a bit older. I think it starts from a young age. And I feel like one of the reasons that I stayed well engaged as a teenager was that the team that I had was always so supportive of my family, and there were always positives talked about primarily in the clinic appointments. And I think highlighting those positives when there maybe are some more serious things to talk about would be really good.
We had another question regarding what specifically our role within the volunteering association is. So Together Type 1 is part of Diabetes Scotland, which is itself part of Diabetes UK. And the main peculiarity of this volunteering role, which attracted me and the others to this role, is that we're all young people from 16 to 25. And there's a plethora of different events that we can both organize or also take part in, for instance, community meetups, and then organizing webinars, including this one. So I think it's a very good opportunity, specifically for someone who's young and has a busy schedule, because you can do as much or as little as you want, and it's very flexible in terms of what you want to do to make a difference. So I would definitely advertise this position if you have young patients.
So another question we got is, what advice would you give to young people who want to tell new friends about their type 1 diagnosis? So I would say that you can say as much as you feel comfortable saying, first of all. Second of all, whatever you think is right, which is not great, but I would say something maybe about what type 1 is. Maybe your symptoms if you're low, just so they can help you out if something goes wrong. And maybe just to tell them, oh, I just want to make you aware, but you don't have to do anything about it, would be a good way to say something. If you feel like you don't want to force your friends into being helpful, I guess. And I would say I would direct them to websites I've been given called Breakthrough T1D that have a whole section about how you can tell your friends as well. And I think Diabetes UK also has a section about this, which has been really helpful. And yeah.
So I think the final question we're gonna take is, how can we get involved with Together Type 1? Which I think Roisin did cover a wee bit, but I will recap just to close us off. So we'll be sending out more information following on from the webinar, and you can opt in to receive the healthcare professional packs from us, which Roisin talked about. They provide great information for both you and your patients. You might want to put up some posters in your waiting rooms and appointment rooms. We all know what it's like to be sitting, no Wi-Fi in the hospital, nothing to do while you wait. And you could give out handouts to young people so that they can learn more. You all have Caitlin and Roisin's contacts, so if there's anything else you'd like to hear, please do reach out. We're also able to attend certain events at your hospitals, so transition clinics potentially we've attended before. Keep an eye out on the Together Type 1 calendar, which is on DigiBeat, so you can see when there's upcoming events near you. You can then spread the word to your patients. We try to cover as much of Scotland as we can, so hopefully there'll be something near you. We're also open to ideas for meetups in your local area, so these can range from go-karting to pizza. We just want there to be something available for everyone and to prove that there's no limits when you're living with type 1. So really, yeah, it's just spread the word. That's the best thing you can do to get involved. So we're going to close up here for today, but thank you so much all for taking the time to come along, and we hope you enjoyed it. We'd be really grateful if you could fill out our feedback form and look out for more events in the future. Thank you very much.
Thanks, everyone.
This is lovely. I like the wee claps. That's really great.
Yeah, keep them coming.
I didn't know that was a thing.
I did see a hand going up there, so oh no, there was a clap. Never mind. Yeah, thanks everyone. You're free to go. I'm going to stop the recording now as well while I remember.
Thank you for coming.
Thanks, guys. Bye bye.